Hi there, my name is Audrey Deering. I'm a genetic counsellor at Care Fertility. I'm sure you are aware this week is Baby Loss Awareness Week. So today I'm going to be talking about the genetic causes of miscarriage and some things that you might be interested in if you've experienced a miscarriage, are worried about it, or have a loved one who has. I'll be checking in on the chat, and some people have sent some questions ahead of time. First, I was going to give a little bit of an overview, and then at the end, I'll try to answer any questions that you might have. If we don't manage to get to all of your questions today, please be sure we'll try to get back in touch by Instagram direct message. There are different types of pregnancy losses. Miscarriage is commonly defined as a pregnancy loss that is spontaneous, so happens without intervention, before 20 weeks. After 20 weeks gestation, we tend to use the word stillbirth. A vast majority of miscarriages do happen in the first trimester, so within the first 12 weeks of pregnancy. And mostly today I'll be talking about genetic causes of miscarriage, so in the first 20 weeks of pregnancy. So pregnancy loss and miscarriage, unfortunately, is quite common. So we think about 10 to 15% of pregnancies will end in miscarriage. Now, because this can be so early, many women do not know that they are pregnant. So some studies have quoted maybe it's as high as 1 in 4 pregnancies, or 25% of pregnancies sadly don't last to term. Again, because it is so common, many women will report having at least one miscarriage. So some studies have suggested that about 40% of women, which is between 2 in 5 women, will unfortunately have a miscarriage at some point in their lifetime. Now, although one miscarriage is quite common, it is much less common to have 2 or more miscarriages over the lifetime. We call it a recurrent pregnancy loss if a person experiences 2 or more miscarriages. Recurrent pregnancy loss does affect about 1 in 20 couples trying to conceive, which ends up being about 5% of people. Again, it's even less common to have more than 2 miscarriages. About 1%, which is 1 in 100, will have 3 or more. Now, obviously, experiencing a pregnancy loss can be very isolating for people, and it's very common to wonder why it happened and if there's anything that one could have done to avoid it happening. I'll spend some time talking about the causes of miscarriage and pregnancy loss. First, not genetic, so there are things like infections of the placenta or in the womb, changes to the cervix or uterus, such as fibroids, thyroid disease, hormonal issues, immune problems like antiphospholipid syndrome, environmental exposure, and of course, genetic problems. Now, my main expertise is in genetic problems, so I'll be spending the rest of my time talking about that today. So genetic problems account for about half of all miscarriages. The word genetic does not necessarily mean that it is hereditary. So most of the causes of genetic pregnancy loss are not hereditary and are something that happens in that pregnancy for the first time. So you might know a little bit about genes and chromosomes. So our bodies have chromosomes, which are packages of genetic information that tell our body how to grow and develop. And if a pregnancy has inherited too many or not enough chromosomes from either the sperm or the egg, it can be very difficult for the body to be able to understand those messages, and unfortunately sometimes that's not viable with life and does end in a miscarriage. So most of us have 2 copies of each of our chromosomes, and we inherit 1 set of chromosomes from the sperm and 1 set from the egg. Now, if a sperm or egg carries an extra copy of that chromosome, then that results in an embryo that has 3 copies instead of the average, which is 2. If an embryo has 3 copies of a chromosome, that's called a triploidy or triploidy. So, for example, Down syndrome is a common triploidy, which means they have 3 copies of chromosome number 21. Unfortunately, most trisomies, again, are not compatible with life. Down syndrome is one of the ones that is compatible with life, and there's 2 other common ones called trisomy 13 and 18. Slightly less compatible with life is a type of chromosome change called a monosomy, which means you have 1 copy of a chromosome. There have been very few babies been born with monosomies, and again, it is something that usually results in miscarriage in the first trimester. Now, how these chromosome changes most often happen is when the sperm, or most commonly the egg, is being created. There's a mechanism that is supposed to separate the chromosomes and make sure that the correct amount go in each sperm and each egg. If there's a mistake that happens when that gamete is being made, then that can result in too many or not enough chromosomes being put into the sperm or the egg. And if that happens to be the one that takes as a pregnancy, then that can cause monosomy or trisomy. So an embryo or a baby or a pregnancy that has the, some say incorrect, uncommon number of chromosomes, that's called an aneuploid embryo. And you might hear of that term when we're talking a little bit later on about a technology called Pgtsr, which we'll get to later. An embryo or a pregnancy has the average number or the correct number of chromosomes is usually called euploid. And again, we'll talk about those terms in a little bit of detail in a minute. So again, some people will be wondering if they experienced a triploid or a monosomy pregnancy, the chances of that happening again. And again, most commonly, it is something that just happens in that pregnancy. We say that if somebody has experienced a pregnancy loss because of trisomy, for example, we think they might have a 1% increased chance of having that occur in the next pregnancy, in addition to the age-related risks for that lady at that age. Very often, doctors will recommend a genetic test on the products of conception after a miscarriage, especially if you have experienced 2 or more miscarriages. And that's to count the number of chromosomes in that pregnancy to see if it was something that happened at conception, like a trisomy or monosomy. This type of test is called an array or a karyotype. So those are 2 different types of tests that can count the number of chromosomes. An array can only tell the amount of genetic information, and it's fairly sensitive. A karyotype can see less large changes of the amount of chromosome, but it can also visualize and see down the microscope exactly the configuration of those chromosomes as well. Now, if a chromosome change has been found in the pregnancy, your doctors might recommend that you, as the parents or the gamete providers, have a genetic blood test to see if you have any changes to your chromosome. Now, obviously, it'd be very unusual for a fully grown adult to have a trisomy or monosomy, again, because unfortunately most of them are not compatible with life. But there might be what we call a structural rearrangement, or a change in the shape of your chromosomes that make it more likely than other people for that to be passed on in an unbalanced or in a way that has results in miscarriage. The type of test that we would do on an adult would be a karyotype, again because that looks at the shape of the chromosomes, not just the amount of genetic information. So if we did find a change in somebody's chromosomes called an inversion, which means one bit is flipped upside down, or translocation, which means 2 chromosomes have swapped places, then we would know that they would possibly be at an increased risk of having another miscarriage, which would be about double the general population in most cases, so about 30% compared to the 15 to 20% that most people experience. It's very uncommon to have a chromosome structural rearrangement. So in the general population, we think about 0.2% of these people have a structural rearrangement. Now in people that do have recurrent pregnancy losses, so again that's 2 or more, we think that's about 2 to 5. So it is still relatively uncommon, but is something that we know contributes to the rate of miscarriage across the UK. There are reproductive technologies that we can do to check the numbers of chromosomes in the laboratory setting in an embryo before transplantation or frozen embryo transfer. So one of these technologies is called pre-implantation genetic testing aneuploidy, so quite a mouthful. So we can call that PGTA, the A for aneuploidy. Now again, what happens in this is the female partner or the egg provider is stimulated to make as many eggs as we can get. They're safely removed with a needle through ultrasound guidance and fertilized with the either the partner's sperm or a donor sperm or the sperm provider. Once the eggs have been fertilized, we start calling them embryos. And when the embryo is about 5 or 6 days old, a healthcare professional called an embryologist safely removes some of those cells and does a genetic test, again to see how many chromosomes are present in that embryo. Now, if there's too many or not enough, we know that there's a very low chance of this taking as a healthy pregnancy and a higher chance of experiencing miscarriage, and we would recommend to not transfer those. So basically, it's a way of creating a ranking system and recommending the embryos that are most likely to take as a healthy pregnancy and the lowest chance of experiencing a miscarriage. If you are a person who has been found to have a chromosomal change, such as a translocation or an inversion, we can offer a very similar type of test to Pgta, which is called Pgtsr, which stands for structural rearrangements. Now, it has a slightly higher accuracy rate than Pgta because we know exactly what we're looking for. And I just see a question coming in about Pgta. Does it have to happen before freezing the embryos? So the embryologist will take the cells away before the embryos are frozen and start doing the test on that. But because the test takes about 3 weeks to get the results, the embryos are frozen at that point, so they're not just growing and growing in the lab while the test is going on. So going back to Pgtsr, so this is for people who have a hereditary structural rearrangement. There is NHS funding for Pgtsr, and we at Care Fertility are happy to be able to offer NHS funded Pgtsr through our Nottingham branch and self-funded through our other branches. There are some stipulations for the NHS funding. So the couple cannot have a healthy, unaffected child together. They ask for the female partner to be under the age of 40 with a body mass index of between 19 and 30. We ask that you're in a relationship for at least a year and that you're living together, but you do not need to have been living together for a year. Unfortunately, Pgta is not currently funded by the NHS, but Care Fertility is able to offer that through a number of our branches. So I've talked a lot about the chromosomal changes that are very common in miscarriage, and I'll just spend a brief amount of time talking about other genetic causes other than chromosomal changes. So going back to chromosomes, that are these units that are packages of DNA. Sometimes there's spelling changes in the genes of the DNA that unfortunately again increases the risk of miscarriage. So one common cause of that might be something called thrombophilia, which is often a hereditary disorder of how the blood clots. So if somebody's blood is clotting excessively, that can make clots on the placenta or in the baby, which can impair blood flow into the pregnancy and again cause a pregnancy loss. So again, if you have had 2 or more miscarriages, some doctors will recommend a clotting study for the female partner to check how her blood clots. There is also a genetic test for something in Care Fertility called Karyotype, which is when we look at a gene called annexin A5, which again is responsible for healthy blood clotting. Now, if the female partner has a mutation called C4M2, that can cause these microclots in the placenta, and again that can help us to know if the female partner would benefit from some treatment at very early stages of pregnancy up until 12 weeks, which would be usually in the form of a blood thinner. So thrombophilia again is a relatively common form of a hereditary predisposition to miscarriage. There are of course very rare conditions, rare genetic conditions, that if both parents are carriers, there could be a 1 in 4 chance of having an affected pregnancy. So these are called autosomal recessive genetic conditions. Again, there's a very, very uncommon, and they're usually something developmental where there's significant problems in the fetal growth and development. And often it's not something that you would necessarily know about until later in a pregnancy. If this was the case, a fetal medicine specialist would likely recommend extra genetic testing, usually initially on the pregnancy and then parents if they suspect that this might be the case. I'm just going to look up, I saw a question come in. Is there NHS funding for men who have suffered from van Bilt before and didn't freeze any sperm? So I'm sorry to say that sperm donation is not currently funded by the NHS as far as I'm aware, but I'll do some more digging into that and try to get back to you later. So I've done a lot of talking about common genetic causes of miscarriage, and I hope that what's coming across is that most of the time it is something that happens by chance, and it's not necessarily anything that anyone could have done to prevent. If you were concerned about having miscarriages, or if you have experienced 2 or more, even 1 or more, and you want to have a conversation about it, of course we can talk to you about the various investigations that you might find helpful. Obviously always a healthy lifestyle helps, avoiding alcohol, avoiding smoking, and so on and so on. But again, most of the time it is something that there's very little that one can do to prevent, especially if it's not something you've experienced before. Now, I know we have some questions here, so I'm just going to read a few questions that people sent us by DM and try to answer them as best that I can. So somebody has asked if all early miscarriages are related to genetics and chromosome abnormalities. So again, about half of miscarriages are caused by genetic abnormalities. Many times we will never know what the cause was, but we can again do some investigations to try to work out what that cause might have been. Somebody has asked, is it ever just one of those things, or is there always a reason to miscarry? So there, will always be a reason why miscarriage happens, but it's not always going to be a reason that is in our control, or even a reason that makes it more likely to happen again than other people. Obviously, developing a baby is a very complex thing, and unfortunately, sometimes the body or even the pregnancy itself just doesn't get it quite right. So somebody else has asked, why do miscarriages happen when an embryo is euploid or genetically normal? And they have no male factor infertility. They've done the karyotype to look for clotting, and they're just experiencing miscarriages. So it's really, really difficult to say exactly why specific things happen. But again, unfortunately, many miscarriages will never have a known cause. I've previously talked about non-genetic forms of miscarriage, and it sounds like you've done a lot of really thorough genetic testing, which is great. And it could be that it's not genetic, or something that we just don't know about, or again, just something that we're not going to be able to find out, unfortunately. Somebody else has asked the likelihood of their wife experiencing another miscarriage if they have had one. Again, that's another thing that's really difficult to say for specific cases. In general, it's important to remember that most women who've experienced one miscarriage will not experience another. If you were interested in more specific advice, you could always speak to a fertility expert here at CARE, who could review your wife's specific circumstances and see if further investigations will be helpful. Somebody is asking if miscarriage is linked to age. So chromosomal changes like trisomy and monosomy that we talked about before, they can increase as women get older. So when we are making our eggs, sometimes the spell check mechanism that counts the number of chromosomes gets less efficient with age. So women who are in their later 30s or early 40s might be interested in learning more about that Pgtsr technology that I mentioned earlier. That's slightly different because we're born with all of the eggs that we have in our lifetime when we're babies, and we just mature eggs as we go through our menstrual cycle each month, whereas men are continuously making sperm, so their spell check mechanism is a little bit different. I saw a question come in the chat. I'm just going to scroll back up to try to find it. So I've had miscarriages within a week of finding out that I'm pregnant through IVF, and I have elevated NK cells, or natural killer cells, and MTHFR gene mutation. Any advice? I'm really sorry to hear that. That sounds really difficult for you. So NK cells are a kind of overactive immune situation, which I'm less of an expert in. The MTHFR gene mutation can make somebody less likely to absorb folic acid in their diet than other ladies or people. So for that, I would certainly recommend folic acid supplementation, at least, or if you can, at least 3 months before having another cycle, or 3 months of taking that, and then to continue taking that folic acid until 3 months of pregnancy, so when you're about exiting the first trimester. Okay, so I think those were all the questions that people had sent to us. I'm just going to give it another little second to see if anybody wants to put anything in the chat. But before I'll let you go, I'll just say that there are many types of miscarriage. There are many causes. Many of these causes are genetic and many are not. Certainly if you've experienced 2 or more miscarriages, you're very welcome to make an appointment to speak with one of our doctors to see what types of investigations might be right for you. And it's really important to know that you are not alone in this. Many, many women and couples and people with uteruses will be experiencing the same things. If you were feeling affected by miscarriage, or if you wanted to talk about with somebody, please do talk to somebody in your family, somebody in your friends, co-worker, somebody you feel safe with. There are also lots of lovely charities. So Tommy's is the largest miscarriage charity in the UK. There's also a support group called the Miscarriage Association UK and the Miscarriage Association of Ireland. And of course, here at Care Fertility, we have fertility counsellors who are able to support you. And I would hope that a lot of our staff would be able to be supportive as well. I see somebody's just asked if they had any suggestions for top quality embryos, Care Maps grade 9, but missed miscarriage. So if you were experiencing many failed implantations, so say you've had lots of embryo transfers that haven't taken, or missed miscarriages, which is maybe you've had a biochemical test, things like that, then I would just say to, again, speak to your fertility practitioner. Very often, if you do have lots of failed implantation or missed miscarriages, they can recommend things like karyotypes, looking at your immune system, things like that. Somebody else has asked, would you recommend a B12 injection for the MTHFR gene? Again, that's mostly related to folic acid. I'd say it can't hurt, but I would certainly recommend folic acid supplementation. Anybody else have any questions for now? Okay, well, we're going to be here in the DMs, so if you did have any questions, one last one. Any vitamins or things to do for an upcoming PGT FET next week? Oh, congrats. I hope that goes well. Best of luck. Again, just folic acid, healthy lifestyle, multivitamin can't hurt, things like that. Just I hate it when people say try to not be stressed, but try to not be stressed. Okay, well, it's lovely to speak to you all. Again, we're going to be here in the DMs for a little while. And if we missed any of your questions, please feel free to send us a message. Take care, everybody. Bye.